Welcome to Extra Point Show. Today we're gonna talk about hepatitis virus. So for this occasion, we're having a video conference with a group of students of the Savannah University. First of all, we go with Alejandra Perez that is gonna tell us about the types of this virus.
Everyone, first we need to know that the hepatitis is an inflammation to the liver, which can become to a liver cancer. There are five main hepatitis viruses, referred to as types A, B, C, D, and E. Hepatitis A virus is present in the feces of the infected person and is most transmitted by contaminated water or food. The hepatitis B virus is transmitted through exposure, infected blood, semen, or other body fluids. Hepatitis C is mostly transmitted through exposure in infected blood, and also sexual transmission is possible. Transmission of hepatitis D occur only in those who are infected with hepatitis B. The dual infection can result in a more serious disease or worse outcome. And finally, the hepatitis E is mostly transmitted by contaminated food or water.
We go with Ingrith Vargas.
New drugs are making big improvements in the way you get treated for hepatitis C. And more, the cure is now in reach. And treatment as this cure for hepatitis C can be get better, and everyone can be helped to everyone, and maybe is be able to look for in the future free for the people who needs that cure for hepatitis C. One advantage of the cure of hepatitis C is that over the time the cure was increased over the time. For example, in 1980s then and in the thousands, the effective was increased about more or less 5%. In 2014, there are three new drugs that are approved by FDA. These drugs are Cimeprevir, Sosbuvir, and Ledipasvir. And the three drugs are can help the hepatitis C virus in up to 18% of people who take it. And in some times, there are people that the people who use the three new drugs or one of these says that this is why this is very excited for the people who because feel that the cure is effective uh, and don't feel side effects.
Now we go with Maria Camila Becerra.
Some of the disadvantages of hepatitis B vaccine are: eventually, children who apply the vaccine may become autistic. For this reason, most experts regard the risks of the vaccine within schools and childcare systems. Autistic, autism risk is generated by the side effects of the vaccine. Another disadvantage of this vaccine is its high cost, because only people with money can access it. Common reactions to the vaccine include fever, muscle weakness, headache, fatigue, irritability, and joint pain. But there have been reports of disorders immunological and neurological disorders that have developed following hepatitis B vaccine. Some examples of these disorders are multiple sclerosis, Guillain-Barré, lupus, and diabetes. Thanks for your attention.